All right. Hello again, and welcome to another Move with a Doc. Thank you again, everyone, for joining in today and taking time, I know, out of your busy schedules and your busy days. As always, kind of the mantra of these talks is just move. It's a good time to move your body throughout the day, either doing some stretching, some walking, biking, squats, anything just to build a little bit of movement into your day if you haven't had a chance already. So today we're going to talk about a health concern that does affect quite a few people. And we're going to talk about autoimmune diseases and a little bit about just regular arthritis as well. So we're going to talk about what autoimmune diseases are, why do we get them, what are some risk factors, and most importantly, I think, what to talk to your doctor about if you think you may have symptoms of one. So let's just start with a quick primer on the immune system, because that's really the hallmark of these types of diseases, just to give you a better understanding of the different parts of the immune system before we move on to the actual diseases themselves. So what is the immune system? People, we've talked so much about the immune system during these past few years, but some people have a fairly good understanding of it now, actually. But it is a very complex network of organs, of cells and proteins that defend our body against infection. Usually, the immune system is protecting the body's own cells. So the different parts of the immune system, and you've seen this if you've ever gone to your doctor and you've gotten a complete blood count, or what's called a CBC. So you've seen the different components on your CBC. So WBCs is usually the first component. You'll see white blood cells. So key players in the immune system. They're made in our bone marrow. They're part of our lymphatic system. They move through the blood looking for anything foreign, any microbes, bacteria, viruses, parasites, fungus. And when they find them, they launch an immune attack. White blood cells include your lymphocytes, which include subsets of, and I'm getting a little technical, B cells, T cells, and natural killer cells, but there's also lots of other types of immune cells we won't get into. So those are the white blood cells. Next, we have antibodies, and I know you've heard a lot about these with all the advent of the new vaccines. Antibodies help us fight microbes or toxins. They do this by they recognize substances called antigens, okay, on the surface of the microbe, which mark the microbe or toxin as being foreign to our immune system. And then they kind of mark those antigens for destruction and go after them. So those are kind of some of the big pieces of the immune system. We also have, and I won't get into it, the complement system, the lymphatic system. Our spleen is very involved in the immune function. Our bone marrow is, as well as the thymus. So it's a very complex, it's a very amazing system. But when there's a glitch in the system, this can result in disease and illness, and that's kind of where we're going today. So let's start with what happens when the immune system makes an overly strong response to allergens. So when this happens, we can develop things like allergic diseases, things like food allergies, think anaphylactic reactions, hay fever, asthma, hives, dermatitis, even eczema. These are all conditions where our immune response is just like in overdrive, okay? Now there's a situation where our immune system can be underactive. So that can also happen, and this can result in what we call immunodeficiency syndromes. This can be caused by certain diseases or virus like HIV and AIDS kind of being the one that kind of comes to the forefront of our minds. But even cancer can result in really prominent immunodeficiency. Okay, so overactive, underactive, and then what if your immune system begins to mount a response against the normal components of your body? And this is where autoimmune diseases can result. So you've probably heard of some of them. I'm just going to kind of list a few different autoimmune diseases. So we can have things like multiple sclerosis, or MS, Autoimmune thyroid disease, actually people don't think about that. That is an autoimmune disease. You can have Hashimoto's, which can then result in hypothyroidism, or the opposite, where you have kind of it attacking the thyroid gland and it can result in a hyperthyroid situation, which results in Graves' disease. Type 1 diabetes, not type 2, type 1 diabetes is an autoimmune disease. Things like lupus, rheumatoid arthritis, vasculitis, are some very common autoimmune diseases people have heard of. Crohn's disease, ulcerative colitis that affect the GI tract, celiac disease, also autoimmune, true celiac disease, not gluten sensitivity. And then psoriasis is one of the skin conditions that's also autoimmune. So we don't know precisely why some people develop autoimmune diseases and others don't, but there are a few risk factors. There's a few medications that are implicated. Some of the big risk factors, though, are if you've got a relative with an autoimmune disease. Some of these diseases can actually be genetic, so they run in family. So it's a good time to kind of just know your family history and to know if these things run in your family. Smoking, always kind of a risk factor, just causes a lot of inflammation in the body. Another risk factor is just already having one autoimmune disease. If you have one, you're at higher risk for developing another one. Unfortunately, being female, 78% of people who have an autoimmune disease are women. Obesity, infections, there's some role that maybe viruses play, and that then can lead people to develop these autoimmune diseases too. So I want to move on to some of the symptoms. And I was sort of not sure if I should include this, because as I go through these symptoms, you're going to sound like, oh, I have all of those. There's a lot of them, and they're very nonspecific. I will give you that. But I do think it's important to just be aware of how certain diseases can present, and then how to talk to your physician then too about your symptoms. And what I want to say here, and I said it in the beginning, is one of the things that's important when you go into your physician and you might list and say, hey, I've been noticing I have all these non-specific symptoms. And your physician may be like, What I think is important is this is where knowing your family history is very important. And if you said, hey, my aunt had rheumatoid arthritis and I am experiencing joint pains, swelling, and stiffness in the morning, or my mother, had Graves' disease, of her thyroid, and I'm having a lot of fatigue, hair loss, weight gain, so in that context, then it can it's not leading the person, but it's giving that valuable information that, okay, this is someone who has a family history of autoimmune disease. And therefore I should be kind of just broadening my differential diagnoses to include other things I should be thinking about. If your family has a lot of GI issues, well, is there Crohn's or ulcerative colitis in your family? That's important to then mention to your physician. So here's some of the symptoms. So diseases of the joints and muscles, we kind of talked about this. If you're having a lot of muscle aches, pain, joint pain, stiffness, swelling in the morning that lasts longer than an hour, any muscle weakness, those can be important to list to your physician. Diseases that could affect the digestive tract, again, these are non-specific. Bloating, constipation, abdominal pain, acid reflux, nausea, food sensitivities, blood or mucus in your stool, really important. These can be early signs of inflammatory bowel disease, like Crohn's, like ulcerative colitis, even celiac disease can have a lot of bloating and malabsorptive symptoms. Diseases of the skin, if you have a lot of rashes, itching, inflammation, hair loss, dry skin, some of the symptoms of hypothyroidism can be hair loss and dry skin, so important to mention those. Diseases of the nervous system, these are always tough too because these are very nonspecific, but if you have a lot of new onset dizziness, headaches, confusion, difficulty thinking, blurry vision, memory issues, numbness, tingling, especially if it's just on one side, you're having like we call them kind of like lightning shocks of pain, where you just get these bolts of zingers into your fingers or into your legs. And then just other kind of non-specific, any swollen glands, if you've been experiencing weight loss or weight gain, irregular heartbeats, shortness of breath, any temperature kind of sensitivities, things like that. So important to mention. So if you're experiencing these types of symptoms, again, I know they're non-specific and you may think, already that you have some of those, but discuss them with your physician. There is a whole host of labs that we can do to sort of get that workup going and to investigate your symptoms and to make sure you don't have some obvious form of an autoimmune disease. And again, as I mentioned, important to know that family history. If you have a family history of rheumatoid, type 1 diabetes, Hashimoto's, Graves' disease, just bring that up with your physician. It's not saying, hey, I have to have this because my mother, my grandma, my father, has these issues, but it's just important as part of your family history to know that. And I just think it helps your physician make a more well-informed decision on which path to go down. So what are some of the things that you can do if you have an autoimmune disease? And of course, number one, you need a diagnosis and you need to get treated by the appropriate specialist. So that's sort of a given. We're just going to go on to what are some other things that you can do. There has been a lot of attention placed on diet and especially an anti-inflammatory diet. So, and I want to switch gears a little bit here and I want to broaden the scope to any type of inflammation in the body, because yes, you can have an autoimmune disease where your body is actually attacking your own cells, but you can just have a lot of inflammation in your body with regular, let's say, osteoarthritis even, or fibromyalgia is felt to be a lot of inflammation for muscles in the body. Migraines even would be included in this. So I feel like with our culture, in our fast food culture, our sort of obsession with ultra processed foods, all of these play a really key factor in total body inflammation. And we've talked about this before, but I felt like this was a good talk to kind of bring that up and just focus our attention on that again. The Arthritis Foundation actually endorses one of my favorite diets, which is the Mediterranean diet. So again, what we want to aim for is a diet really low in ultra-processed foods. We want to aim for a diet rich in whole foods, fruits, vegetables, fish. There's been a lot of good omega-3s found in fish, nuts, beans, and then just again, limit the saturated fats and then the processed foods in the diet. And most of these are principles of the Mediterranean diet, which is always sort of brought up and touted for its anti-inflammatory properties, disease-fighting properties, especially in folks who have inflammatory conditions. So what are some of the foods to incorporate? Well, I mentioned one, fish. Now, I know not everyone likes fish. I kind of struggle with it too, but I can sort of make myself eat salmon because I know it's good for me. So how much? Well, health authorities like the American Heart Association and the Academy of Nutrition and Dietetics recommends about 3 to 4 ounces of fish twice a week. Some of the arthritis experts say that even more is better. And again, why fish? Well, fish is a good source of inflammation fighting omega-3 fatty acids. So that's the key, that's what they have. One study had found that folks who had the highest consumption of omega-3s had lower levels of 2 inflammatory proteins in the body. One is called the C-reactive protein, CRP, and another is interleukin-6, which is another inflammatory protein. So they had low blood levels of those two. Researchers have also found that taking fish oil supplements, a lot of people do this, I know, does help with reducing joint swelling, pain, the duration of morning stiffness, and disease in people who have rheumatoid arthritis. So I also think that if you have osteoarthritis, this can be very effective. Your best sources for omega-3 fatty acids are going to be salmon, tuna, sardines, herring, anchovies, scallops, and other cold water fish. So again, you hate fish, that's fine. Take a supplement. Studies have shown that taking 600 to 1,000 milligrams of fish oil can really help ease joint stiffness, pain, and swelling. So if you're suffering, I would try it. Try it for 1 or 2 months, see if you notice benefit. I know some people have complained about the belching from it. I do know if you put it in the fridge, sometimes you can alleviate some of that. So don't forget about nuts and seeds. Another really potent source. How much do you need? About 1.5 ounces of nuts daily. And 1 ounce is really just a little handful. So it's not a lot. I always have to remind myself like not to grab a giant handful. It's really just what fits in the size of your palm. And multiple studies have confirmed the role of nuts in anti-inflammatory diet. One study over a 15-year period, men and women who consumed the most nuts had a 51% lower risk of dying from an inflammatory disease compared to those who ate the fewest. So another study found that subjects with lower levels of vitamin B6 found, which is actually what's found in most nuts, had higher levels of inflammatory markers. So kind of take that for what that's worth too. Other good news about nuts, they are jam-packed with inflammation-fighting monounsaturated fats. So we don't want polyunsaturated fats, we want monounsaturated fats. So they're good for that, but you have to remember with nuts, less is more, because nuts do have a lot of fat and can contribute to a lot of calories too. But on the flip side, they're a high source of protein. So if you do kind of snack on nuts, you're going to potentially be able to stabilize your weight as well and promote weight loss because of all their protein, their fiber, and the monounsaturated fats. And we've talked about this before in the hunger hormones and ghrelin. And so you're suppressing that ghrelin when you have a lot of protein and fiber in your diet. So be careful with nuts. I know when I go to the grocery store, I'm like, oh, I should start eating some nuts. I'm always I look on the shelf and everything has, like salt and vinegar. And so it's better to focus on the raw version because you don't want a lot of salt and sugar added. You're going to get more calories that way. So I like to buy some of the small bags like from like Trader Joe's or the grocery store and then make my own mix. And so that's probably the best way. So try and aim for the raw version of your nuts. Which are the best ones you want to get? Walnuts, pine nuts, pistachios, almonds, and then even like seeds like pumpkin seeds, are good. So, so I wanted to kind of focus on fish and nuts. I think we forget about that sometimes, but of course, don't forget about foods that you might be eating a lot of that are high in carbohydrates and sugar. Those are going to lead to inflammation in the body and your gut. So if you have celiac, if you have Crohn's, ulcerative colitis, you want to limit those. And of course, the effect that has on the gut biome as well. And alcohol. Alcohol has inflammatory effects on the body and the gut. So if you're struggling with inflammatory conditions, I would just kind of end with saying these kind of few things. Get more sleep. We know sleep is restorative for our body and total inflammation in our body. Cut back on alcohol, beer, wine, hard liquor, all of it. Add in fish. Twice a week is ideal. Once a week is really good. Add in some nuts for a good snack. And try your hardest to cut out, I would say all, but that's not always possible, but really limit any ultra processed food that you can in your diet, and then replace that with high quality protein, fruits, vegetables, and fiber rich foods, and things with antioxidants. Okay, so that's sort of what I have for you today. I hope that was a little bit just of a helpful overview of different autoimmune diseases, some symptoms, how to talk to your doctor, really, and then understanding your chemistry panels and your complete blood counts and what those really mean. I do get a lot of questions from my patients who have my chart when they see their CBCs and they're like a little, WBC can be off, or a lymphocyte count or monocyte count can be off. Those are minor things in your panel, those aren't things to worry about, but if you have questions, definitely touch base with your doctor. They could be important, especially if you're having other symptoms. But again, just to get educated on those. So I hope this was helpful. If you have questions, please reach out. Otherwise, have a great rest of your day.